As we embarked upon our journey to improve quality and patient safety for those we serve, we recognized that there were a number of audiences that we had to link together with a vision and a mission. We boiled it down into really some pretty simplistic approaches. We've said that we've got to get our employees to engage as if this was one of their loved ones that's in the bed that they're taking care of. It's got to be real.
You can't determine how well you're doing unless you compare yourself to core standards, and we have a lot of different ways of doing that. We think the Hospital Engagement Network's been a wonderful resource for the hospital in that it enables us to compare how we are doing against other hospitals, not only in the state, but in the region and also within our group.
All right, guys. Getting everybody on the same page is very important because it takes all of us working together to make sure that we provide safe care to our patients and we have good processes in place. With catheter-associated UTIs, we had our medical staff work with the hospital staff to put together a Foley Reduction initiatives where we pull the Foley catheters within a certain time period, and we've seen like a 90% reduction since 2010.
All the efforts that are going on.
We have a great readmission reduction effort. We have a staff that call patients at home after they're discharged.
Just wanted to call you today and follow up.
I think we probably made about 30,000 telephone calls to patients that were discharged within the last year. When the staff call those patients, they're checking to make sure that they've gotten their discharge meds, that they have made the appointment with their physician for follow-up.
Our goal is to exceed your expectations.
And we've seen excellent progress.
I really thank you for choosing Trinity Medical Center.
People start taking pride when they start seeing the results through the data. And all of a sudden, the data becomes inspiring to others to try to say, how can we eliminate these variances?
Data is very important to our processes. We use that to be able to see if we have variances and whether or not with those variances we need to pull a process in and break it apart and see what's not working.
The HEN allowed for an environment by which hospitals around our state could come together and talk about the issues that they were facing, talk about what are the protocols and practices within our organization to which there has been success. It was an opportunity for us not only to share our best practices, but to engage with others.
Helps to drive change as well.
It's been very fruitful.
People need to know when they're doing the right thing because it adds to the enthusiasm, I think.
We have seen significant reduction across the board in everything that we've worked on since we've put OB harm initiatives in place. We've had no early elective deliveries and no babies that were transferred to the NICU. With our catheter-associated UTIs, we've had a 90% reduction. With the central line-associated bloodstream infections, about a 70% reduction. Now with those, our goal is to work to zero.
In the healthcare field, we're here to do one thing. We're here to make people well. And we can learn from other hospitals. The Hospital Engagement Network gives us a wonderful way of seeing how other hospitals are doing things, where things are working for them, where maybe some things are not working for them. And it makes all of us better and stronger.
Thanks for tuning in to HN Daily's special coverage of the Health Research and Educational Trust's Hospital Engagement Network. This project has been brought to you by the Center for Medicare and Medicaid Innovation, the Partnership for Patients Initiative, the American Hospital Association, and the Health Research and Educational Trust.